Metabolic acidosis. Step 1. Look at the pH. If the pH is lower than 7.35, then this represents acidemia. Step 2. Look at the bicarbonate. If the level is low, then metabolic acidosis is the case. Step 3. Calculate the anion gap. The formula is sodium minus chloride plus bicarbonate. Greater values represent high anion gap metabolic acidosis. Keep in mind to correct the anion gap. For every 1 gram decrease in albumin, the anion gap decreases by 2.5. Step 4. Respiratory compensation. Use the Winter's formula to calculate the predicted PCO2 by multiplying the bicarbonate times 1.5 plus 8 plus minus 2. Values greater than predicted represent that there is a respiratory acidosis, a mixed disorder going on. Values lower than predicted indicate that there's an additional respiratory alkalosis. Step 5 is the delta-delta. Calculate the delta anion gap by subtracting the patient's anion gap minus the normal anion gap and do the same with the bicarbonate of the patient. After this, divide the delta anion gap by the delta bicarbonate. When you have a result between 1 to 2, then there's a pure high anion gap metabolic acidosis. Greater than 2 represents an underlying metabolic alkalosis, and less than 2 means that there's a concomitant non-anion gap acidosis.